All right, thank you so much for joining us once again on your favorite program, Health Corner, on the Steam Radio Vision, located at Obokun Avenue, Ilesha, Osun State, Nigeria. What we do on Health Corner, we we give out information, useful information that pertain to our health as individual and collectively, just for us to learn one or two things that has to do with our health. Like I do say on this program that health is wealth, so that we will know that we should take our health first. On today's edition, what we are going to talks about, it has to do with something that deal with brain. You know, the brain, like we know, is what operates all other part of our body, other part of the body. It is through brain that all this and the rest part of the body operating, and that is where we want to talk about. Let me appreciate the Chief Executive Officer in person of Deacon Michael Adeboye Ashaolo, and the man behind the console, that is Faloye Ayomikun. Thank you so much for your time, and I want to appreciate all the esteemed crew for their contribution. As usual, I have with me on the line no other person than our regular nurse on the Earth Corner, in person of Nurse Nwoko Ezinne Mary Constant. Good evening, ma.
Good evening, Mr. Afolabi.
All right, thank you for joining us once again on Earth Corner for today.
It's my pleasure. Thank you so much. It's my pleasure.
All right, now we want to talk about something that has to do with the brain. Something that has to do with our brain. That is what we want to talk about today. And some people may look at what we want to talk about, that what's the meaning or what's the topic. I want to say it, that is hydrocephalus. That is hydrocephalus is what we want to talk about, and it has to do with brain. Now, as a layman, there is a lot of causes, and we recognize that okay, this thing is feasible, and there is a treatment. We want to know all this. This is what we want to talk about, and let me start with this question. I want to direct this question to Nurse Nwoko now. You see, just for us to begin with the topic for today, what exactly is hydrocephalus?
Thank you, Mr. Afolabi, for having me. Thank you so much. Well, hydrocephalus is nothing but a medical condition characterized by abnormal buildup of what we call cerebrospinal fluid. Cerebrospinal fluid is the fluid in the brain. When it accumulates abnormally, when it builds up abnormally in the brain, it can cause what we call hydrocephalus. And because it causes a lot of pressure inside the brain, it can damage the brain tissues if it is not treated early. And it's most common in infants and older adults. It's common in infants. You can also see it in children and even in some adults as well. So what we call hydrocephalus is a medical condition characterized by abnormal buildup of cerebrospinal fluid inside the brain tissue. Thank you.
Okay, thank you. Like you said that it's happen inside the brain tissue. Now, can you describe briefly how it looks like? For instance, if at all we have opportunity to set our eyes on it, how does it look like?
All right. Well, the thing is that this cerebrospinal fluid is a fluid that helps to give a cushion, a kind of cushion to the brain. It removes waste from the brain. It transports nutrients to the brain. It makes the brain to be so like if I'm to draw the diagram of the brain is just like a coily, just like the intestine, a coily organ that is inside a cup, like a skull. Then it is being supplied by that what we call the cerebrospinal fluid. So circulation of that cerebrospinal fluid, when it becomes too much, it can make the brain to start swelling, especially in children or neonates, infants or children. When I mean infant, children under 1 year. Then children from between 1 year to 5 years are older children, are the ones we call children. Then, and also adults, it can also happen in them. So when that fluid starts accumulating, it can cause the brain to start swelling, so that you see that baby's head to become big. Do you understand?
Okay.
So it is that swelling. That swelling is actually what we call the hydrocephalus, because that fluid that was supposed to be in minimal quantity inside the brain is now becoming too much, that is now causing a lot of pressure and swelling in the brain. Thank you.
Okay, thank you for that beautiful response. And now I understand that if someone to knows it, it's like when something swell up in one's brain. Okay. Now, with
Yes.
with what you just described now, I want us to, you made mention of the CSF. We want to understand that. What does that mean?
CSF means cerebrospinal fluid. Like I said, it is the fluid that protects the brain, that gives it a kind of cushion. It helps to transport nutrients. It helps to remove waste from the brain. There are metabolism that are going on in the brain. So any waste that comes out, it is this fluid that removes it from the brain. It also supplies it with nutrients. So CSF simply means cerebrospinal fluid, the fluid in the brain that is responsible for removal of waste, cushioning of the brain, and transportation of nutrients in the
Okay,
brain.
okay.
And also, it also helps to make it food.
Okay, what you are saying now is that, like, we have waste in other parts of the body. Like, okay, for someone, if someone eats, you have to go to restroom to excrete. And are you now saying that we also have waste in our brain?
Yes, just like the brain processes information, there could be is a kind of metabolism going on in the brain. So any particles, any waste that is in the brain, it is this fluid that does what? That removes it, that flushes it out from the brain.
Okay, now what are the causes of hydrocephalus? What are the causes?
Well, the causes vary. We have some causes in children, we have some causes in preterm babies, and also have some causes in infants. So in children, it can be as a result of what we call neural tube defects, okay, or infections in the womb. Then in newborn and preterm, it could be as a result of bleeding in the brain. When they start bleeding in the brain, it can lead to a hydrocephalus. Then in children, in older children and adults, it can be as a result of head injury. It can be as a result of what we call meningitis. Meningitis is the inflammation of the meninges. Then it can be as a result of tumor as a result of cancer tumor cells, or all these cells that grows in the brain. It can cause hydrocephalus. It can also be a complication of after surgery. So those are the causes.
Okay, bleeding in the brain. Like, we were aware that if there is a bleeding in one's brain, it means it can react or turn to a psychological problem. Is this statement true? Hello, can you hear me? Or did you get the question?
Yes, I can. I got the question.
Okay.
Yes, man. Yes, the brain doesn't need any other fluid apart from that cerebrospinal fluid, and that cerebrospinal fluid should be in a normal quantity. So when when another thing now like blood comes in contact with the brain, it can it can cause some kind of malformations, and the person will start behaving abnormally because it is affecting, like you said, you told the viewers earlier on that the brain is the center of everything. Everything that happens in the body is being calculated from the brain. So when the brain is being occupied with blood, spectrum very well, it will start motioning. So the main seat of the body seat, the body thing. Blowing.
Hello, Nurse Nwoko.
Can you hear me?
Yes, we are unable to hear you. That is why I have to call your attention now. Okay, can you please come again so that our viewers will be able to understand what we mean or what we are discussing earlier?
All right. I said you asked if bleeding can cause psychological problems in the brain if there's blood in the brain, right?
Exactly.
Yes, and I said yes.
Okay.
Because the only fluid that is in the brain is that cerebrospinal fluid. That's the only fluid that can comfortably flow in the brain and give it nutrients, remove the waste, and make it have a cushioning effect. Give it a cushioning effect on the brain, and also help it to stay afloat. So when there is bleeding, like blood inside the brain, it could cause some damages. It will irritate the brain, and they will start malfunctioning. And that malfunctioning is what will present as that psychological problem that you see the person manifesting, except if it is handled as soon as possible. That's when you don't see those psychological problems. But when it is left for a long period of time, it will irritate the brain, and the brain will start malfunctioning. Like you told our viewers earlier on that the brain is the main seat of the functions of the whole body. So if it is affected in any way, it will affect the whole body. It will affect the walking, the talking, the sleeping, and everything that has to do with the brain. So when there is bleeding in the brain, it could affect the person psychologically. Thank you.
Okay. Thank you for that beautiful clarification. Now, what are the symptoms of hydrocephalus in infants?
Okay. You have things like their head will become increasingly big, to start getting big. Then there's what we call fontanelle. Fontanelle is after the forehead, just a little bit inside the head. You see there's an opening. When a child is born, it's not it's not completely closed until some months, like 12 to 18 months. That's when it will close completely. So it will start getting soft and bulging out. Then you can see some prominent veins. You can see some prominent veins on the skull. The veins in the skull will become very irritable. It can be vomiting. It can be having poor feeling, downward looking downwards. His eyes may be looking downwards, and we call it sunset eyes, sunset sign. The eyes will be looking downwards instead of normal way of looking upright forward. It will be looking downwards. We call it sunset sign. Okay, and early recognition of these signs can save lives. So these are the signs you can see in infants. You see things like rapid growing of the hair size, bulging of the soft fontanelles, prominent scar vein, vomiting, poor feeding, downward looking eyes, which is called the sunset sign. Those are the signs you see in infants. Thank you.
All right, thank you. I think what I understand with that terms you make use or you use, that is fontanelle that you talks about. in Yoruba language, I think Yoruba people call it Auje. I don't know what you call it in your own language, in your own dialect. What do you call it?
Some people call it Nkuwishi. Nkuwishi.
Okay.
But I don't know. I don't really know what exactly they call it. But I know I can describe what I know you understand what I'm trying to describe, and
I
I'm sure
understand
what you
it.
said in your language that is what it is. I don't
Yes.
know if it have a particular name in Igbo language. I don't know if you have a particular name in Igbo
Okay.
language.
But
But that is where the Nkuwishi normally takes place. There's a condition they call Mbawishi, it takes place in children. That's the sport it takes place.
okay. Like Yoruba people, the Yoruba people believe that when you have a baby, that spot is no going around, and you have to be careful, wow, not to touch it
Mm,
anyhow, because the part is somehow soft. That is what
yes.
Yoruba people
The
call it.
bone there is not wet close.
Yes, Yoruba people call it auje, and you thank God that
Okay.
you gave us the medical name for that. That is fontanel now.
Fontanel.
Fontanel, for many
Yes.
of us who did not know what it is called in medical term. Thank you for that beautiful explanation. And what is the symptoms in the older children or adults?
All right. Thank you so much. In older children, we can see things like headache, and this headache commonly come especially in the mornings. They can have vomiting. Their vision may be blurred, that kind of not very clear. They can have poor performance in school. They may even have seizures and also difficulty in walking. Then in adults, you can have things like headache. You have things like memory problems. You have things like walking difficulties. They happen usually happen in the type they call normal pressure hydrocephalus. So in adults, we have things like headache, memory problem, walking difficulties, and urinary incontinence. Then in children, you have things like blurred vision, vomiting, poor performance in school, seizures, and walking difficulties. Thank you.
All right, thank you. You talked about the poor school performance. Can this be the causes of uh, forgetting?
Yes, because the brain is already affected because of the too much pressure. So the area for memory will not be affected. So the child may not be able to remember all the things he was taught, or he may forget them and all that. So that's why he's pointing at poor performance in school, inability to recall or remember or store informations as
Okay,
regards to his or her school.
okay. Concerning this, psychologists believe that if a particular child is having the problem of forgetting, it means there is a lot of water in the brain. Can all these things be evaporated and the child will become normal?
Yes, it can. It can. It's a surgical procedure. There's a surgical procedure we call VP shunt. It can be done.
Hmm. Okay, it's something that they can operate.
Yes, it can be operated on, and the baby can live a normal life.
Okay.
But there will be a shunt that will be diverting the fluid from the brain to either the heart, to the atrium, or to the intestine, to the abdomen. So anywhere.
Okay. How is hydrocephalus diagnosed?
All right. For infants, you have what we call the ultrasound scan. This one will show you enlarged ventricles. It will show that the ventricles of the brains are enlarged. So we have also things like CT scan, that's computed tomography, and the MRI, that is magnetic resonance imaging. These ones are also used to give a clear images of the structures in the brain. Then in older adults, especially those suspected for normal pressure hydrocephalus, you have to take the sample of that cerebrospinal fluid and kind of see if, when it's being removed, there will be improvement in the symptoms. So kind of a removal of some of the cerebrospinal fluid can be a form of diagnosis for how to diagnose if the cerebrospinal, if it is removed, there will be a relief of symptoms and all that. So things like CT scan, MRI, ultrasound scan are what you can use to find out or diagnose hydrocephalus. Thank you.
Okay, thank you. Is hydrocephalus treatable, and what are the available treatments, available option for the treatment?
Yes, it is very, very treatable. And the main treatment stem is surgery. And the name of the surgery is called ventriculoperitoneal shunt. That's VP shunt. You know, and what it normally does is to drain excess fluid from the brain to the abdomen, like I said before. We also have another method that we call endoscopic third ventriculostomy. This one is useful for hydrocephalus, for obstructive hydrocephalus. In this place, they create a new pathway for the cerebrospinal fluid to flow. That's what the endoscopic third ventriculostomy does. That's what they do in that one. So we have the VP shunt and the ETV. Then we also have in infant, that ETV can be combined with choroid plexus catheterization. When you catheterize because the choroid is in the choroid, so when they catheterize it with the ETV procedure, they reduce the production of cerebrospinal fluid, thereby reducing the hydrocephalus, because that increase in that cerebrospinal fluid that causes pressure in the brain. So when they were able to reduce the volume of that cerebrospinal fluid, then the hydrocephalus has been handled. So like in a nutshell, hydrocephalus can be treated with VP shunt, ETV, and choroid plexus catheterization. Thank you.
All right, thank you, man. Let me quickly ask this question. We want to look at the preventive measure rather. Can hydrocephalus be prevented?
Yes, it can be prevented. That I remember telling us about the small but mighty medication for pregnant women. That's folic acid.
Folic acid.
It has to help. Yes, it helps a lot. It helps in all these neural tube defects. Then when a mother has infection, you should treat it promptly, especially pregnant mother. They should treat it promptly. They should not leave it, and they should attend antenatal regularly, because that is where they can lay their complaints. The things that is happening in their body can be discovered early and prevented. Then they should prevent meningitis through immunization. By so doing, they can prevent, because meningitis is a disease of the brain and the meninges. So we can help to prevent it by taking immunization. Then make sure they should have a kind of safe child practices. This one is for the healthcare practitioner, so that they will not have birth trauma. So the babies that are coming, because trauma so when there's a lot of trauma, it can cause hydrocephalus. So it's being practiced, it can reduce the level of hydrocephalus that is occurring in our society. So things like prevention of taking care of infections promptly, attending antenatal class, having immunization for meningitis are the ways and you can prevent hydrocephalus, and also as well as making sure you practice safe delivery practices that prevents injury. Those things can help preventive measures for hydrocephalus. Thank you.
All right. Thank you for that beautiful and insightful explanation. And just before we go, what was your final message for people who are with the hydrocephalus that we are talking about, and for them to prevent it before it happens? What is your final message for people who are watching us right now?
All right, my final advice to the public and all those even those that have hydrocephalus, or mothers with babies with hydrocephalus, is that they should relate this information to the public. They should tell their families and family members what they have learned today, and know that the hydrocephalus is treatable, but the only key to this being treatable is early detection. When you are with a baby, you notice your baby's head is getting unnecessarily big. Don't keep quiet. Come back to the hospital. Go to a good hospital. Meet a neurosurgeon. He will know what to do. Don't monitor your baby. Don't watch your baby's head grow so big that you are not doing anything. You're not seeking medical help. Whenever you notice something unusual in your baby's head, just alert your medical practitioner so that they can look into it and know whether it is hydrocephalus. Then adults with memory should go to the hospital so that they will be taken good care of. They will be investigated and find out whether it is hydrocephalus.
Sorry. For the adult, I want you to come again because we have a technical inch now. For adults.
Yes, I say for adults that are having difficulty with memory, they're having memory problems or difficulty walking or urinary issues, they should also be evaluated. They should seek medical help so that they will know whether it is hydrocephalus, so that they can meet a neurosurgeon on time. Because, like I said before, hydrocephalus is treatable, but it has to be detected very early so that the treatment can be complete and come out with good prognosis. So with proper treatment and follow-up, you can live a healthy life. The baby of a mother with hydrocephalus, a mother with a baby with hydrocephalus can live a healthy life once the VP shunt has been instituted and every other thing needed, follow-up and all those cares that are necessary. Once they are instituted early on time and follow-up is being carried out, it is very, very treatable. It is not something that cannot be treated. It is treatable, but it has to be detected early so that the treatment can be complete and the baby and the mother can come out with good prognosis. So, and for adults that have difficulty urinating, difficulty walking, and memory problems, they should not keep quiet. They should seek medical help early so that they can be taken care of.
All right, Nurse Nwoko, if you are still there, listen to me right now. I want to ask this question. There's some elderly one that they quickly or easily to forget things. Can we say loss of memory or in adulthood is it as a result of this hydrocephalus? Nurse Nwoko, are you there?
Yes, I'm here. I can hear you.
Okay, your take on that question.
Yes, it is not all memory loss that is hydrocephalus, especially in adults. That's what we call Alzheimer's disease. That's a kind of memory problem that can happen in adulthood, in late adulthood, that in old age. You cannot call it hydrocephalus. Hydrocephalus has to do with swelling in the brain, pressure in the brain. But when you have memory loss, and there's another thing that causes it, except if you have other symptoms like urinary problem, difficulty walking, then you can think of hydrocephalus. But if it is just memory loss, that's why you need to see your doctor so that they will find out whether it's hydrocephalus or Alzheimer's disease or any other thing altogether that can be taken care of. Thank you.
All right. Thank you, Nurse Nwoko, for your time. I really appreciate you for giving us out of your time for us to learn new things about hydrocephalus, which has to do with the brain. Like I said earlier in this course of the program, that our brain is the central, is the one control every part of the body, and we need to take good care of our body. Thank you so much, Nurse Nwoko, for your time.
It's my pleasure, Mr. Afolabi.
All right, till tomorrow that we will still meet again on the Earth Corner. Bye from me. And to all our viewers, I want to say thank you for staying tuned till the end of the program. I believe you've learned one or two things like I do, because I've learned one or two things. Like frontal today, I understand what it really means, and this hydrocephalus, what we need to do about it. We need, if we discover it, we detect it earlier, we should report to the medical practitioner, the appropriate place, just for them to uh, diagnose it, whether it is hydrocephalus or it's another things entirely. Because I think this thing want to relate with like a tumor of the brain, you know, and the way it affects, it's just different from one another. But just for us to be on the safer side, if you discover, like Nurse Nwoko said, that if you discover that your child, the head of your child is developing abnormally, approach the medical practitioner. Let them know that this is what is happening. From there, they will give you the normal treatment. Once again, on behalf of the executive producer, Deacon Michael Adeboye Ashaolo, and the man behind the button, that is Faloye Ayomikun, AY for short. Thank you so much for your time, and to all the other staff and the members of Esteem Radio Vision, I'm saying thank you for your contribution. My name is Adenipekun Afolabi. Until we meet tomorrow, I'm saying to you, eat healthy and stay healthy. Bye for now.
Breathe, unwind, be free. Health Corner, where your best self starts to be. Take it slow. Let the rhythm restore. Health Corner, illness at your door. Morning light rising, feel it on your face. Let your heartbeat settle into gentle pace. Sip your water slowly, let your body